to everyone. I'm back. It's the first one of the new year, so welcome to all my followers. Good to see you all here today. New setup on the gram with my bendy phone, so I'm hoping that looks okay on Instagram. I have to check it because it looks a bit weird on my screen because it's kind of bent. But anyway, oh, and I can't really. Oh, I can see. Oh, Corinne's here. Oh, I can't see so well actually. That's the thing. I thought this through anyway. So yeah, good evening all, and I hope you've had a nice festive break. And yeah, back to it as if it never happened. And yeah, so we're back at work this week, and I know some probably back at work last week, wasn't it? But yeah, good to be back at it. I can't see that. What's that say? Oh, Corinne, Happy New Year. Happy New Year, Corinne. Yeah, Happy New Year to you too. So yeah, I've got some questions to get on with. So if you've got any questions, oh, there was one on the Instagram. I do like it when they put on the Instagram, so I made a note of it because I'm not quite sure if I can find out those. So two-part question: do you offer twilight, and are there before and after photos of the other surgeons on the website? I think was the question. So do we offer twilight? Yes, we do. Just talking to the anaesthetist about it today actually, because we certainly offer it, and we kind of I've kind of gone through phases with it because we never used to do it at all, hardly ever, unless someone had a real sort of phobia of anaesthetic. And then COVID came along and we did it quite a lot. I'm kind of hoping it's all working on Facebook because I don't think there's anyone there I'm not sure if Facebook's working very well these days. I'm using a special software on Facebook and I think it's making it worse. Either that or it's just not very popular on Facebook, which surely can't be the case. It must be the software's problem. Anyway, I'm going to push on. But yeah, so we never used to do it at all before COVID. And then COVID happened and had a real problem with the hospitals, getting into the hospitals. And there are only certain places we could work. And the places that me really. Well, I'll say we. I'll keep on the we. Makes me sound more important. And that was, we could only do local installation or twilight anaesthetic at those places. So basically that's all we could offer. And so we did quite a few cases of local installation, and it worked really well, to be fair. It did work really well. Patients recovered really well, home and stay cases. And we thought, wow, this is great. This is the way forward. Now I am back in hospital where you can do local installation or general. I don't do as much as it, and I did a patient today actually who had actually previously asked about local installation, and my view about it has changed slightly. I spoke to the anaesthetist about it. I mean, I don't know. I probably need to get an anaesthetist on here, or at least two anaesthetists on here to talk about the pros and cons of local installation. But it seems that the sedation that is required for these cases is quite a deep sedation. It's not like just a couple of diazepam tablets. It's quite a deep sedation, which is almost like a general anaesthetic, but the airway is not protected. So they would say, well, you can do it and it's fine, and not saying it's not safe or anything, but it's a little bit more kind of intense from the side of the anaesthetist. And they would sort of say the benefits are slightly less really than what you might think. And so are the benefits that much? Do people recover really significantly better? So I don't know. And one of the problems is you find that the places that kind of promote it are the places that can only do local installation. And I've always thought if it was that good, surely places that can do GA would do local installation. If it was better than GA, why is it only places that can do local? A bit like vasoliposuction. Some people only do like vasoliposuction. Make sure they think that's the best thing ever. And it's like people who do all sorts of liposuctions and treatments and things maybe don't promote it quite as much as some people who just sort of do it. And it's like if all you've got is a hammer, everything looks like a nail. I don't know if that makes sense. People in plastic surgery often say that if you've got a sort of full repertoire, you'll choose the best thing, whereas if you only got one thing that you do, you'll make everything fit that. So I don't know. So I'm a bit less. I'm fine with it, and so we do offer it. And if someone wants twilight, absolutely fine. but I'm a bit less kind of positive kind of about it, because I'm like, you know what, it's quite deep, the sedation, and certainly in cases of breast asymmetry, it can be a little bit difficult because you have to inject local anesthetic into the breast, and that can make it a little bit more difficult if you're using sizers and if you're using different size implants and things. Sometimes it can be a little bit uncomfortable for patients and things like that. So, you know, we do offer it for sure, but I'm a bit more on the fence on it now, and we've gone back to doing majority of things under GA, I'll be honest with you, although we still do offer it. Absolutely. I've got someone written something on that, but I can't read it because my phone's bent. I'm a cat. Hi, JJ. Happy New Year. I have a question for you. How long after having moles removed on the torso am I able to start exercising again? Name you running. Thank you. Do you know what? I've got a second part question which I haven't answered. So the first part, I will answer that, Mia, but I will got a second part of my other question. Do you offer Twilight? The other one was before and afters of the surgeons on the website. You know what? We should. I feel like I'm looking down at that. Is that better? I feel like no, we don't. We it's on the list of things to do. You might have. I did a thing the other day or a little while ago saying about sort of doing less operating, and one of the reasons I'm doing less operating is because I want to kind of build up the practice a bit more. And one of the things about building up the practice a bit more is trying to sort of work on things like the website and what have you, which takes a lot of time. And if you're doing a lot of operating, it's hard to kind of do both. And yeah, that's something we've thought about doing, maybe having you know, specific cases by specific surgeons on the website, whereas at the moment it's just all a big mix and it doesn't really specify who's done what. It's just or the before and after photos. So yes, that's a good point about having specific before and after photos with the specific surgeons. And thank you for that comment. And it is a work in progress, and it's on the list. It's on the list, and who knows, in 2024 maybe I'll be able to look at working on that. But that's a fair point. Fair point. So Mia, what you got? You got what about something about a mole on a torso? What was it again? How long after having moles removed on the torso start exercising again? So I mean, I'm thinking they're going to be small. I might be wrong. You can get big moles, but because it kind of depends on how much tension there is, Mia. If you've got a lot of tension, then you're going to be a little bit more careful about it. But on the torso, we will often use dissolvable sutures underneath the skin, and maybe dissolvable sutures in the skin, maybe, you know, completely dissolvable sutures, or maybe a dissolvable suture and a non-dissolvable one that comes out later. But bottom line being, you often use more sutures in the torso to keep it together because you worry about it sort of stretching, the scar stretching, what have you. So if it's not under too much tension, the wound should be healed in about a week or so. So I would say after a couple of weeks, you can start gently doing things. Running, the thing about running, you can get a bit hot and sweaty, and so you don't want to get hot and sweaty while the wound's kind of healing. So you want that wound to be properly healed. So I would say 2 weeks, you know, and then sort of start, assuming it all heals up okay. If it doesn't heal up okay, a little bit of red bits, a little bit of scabby bits, then maybe take it a bit easy for another week or so. But if it's looking pretty well, nicely healed, obviously it'll be quite red at that stage, then 2 weeks. But, you know, always, I'm not sure if I'm your surgeon there, but always talk to your surgeon. If it is me, then that's what I'm saying, or at least ask me, because I'll talk specifically about your case. But always best to talk to your surgeon. But yeah, 2 weeks gently getting into it again, I would say, is my answer on that one. Yeah. Thanks for the question. What treatment takes off a mole permanently, like it won't come back at all? I don't want it to regrow. So the way to think about this is, if you look at a kind of like a cross section of the skin, you've got to think, where is the pigment cells? A mole A mole is a collection of pigment cells. So pigment cells are throughout the skin, melanocytes they're called, they're throughout the skin, and they are just more of them in one area that makes up a mole. And they are distributed throughout the thickness of the skin. So if you want to get rid of it completely, you will have to take the full thickness of the skin. You'll have to destroy the full thickness of the skin somehow. Remove it or destroy it or burn it or scrape it or, you know, cut it out. So you need to, if you want to take away a mole permanently, you're going to have to destroy the full thickness of the skin. And there's different ways you can do that. You can burn it with a laser, you can burn it with acid, you can grind it off with a dermabrasion thing, you can cut it out, you can scrape it out with a spoon. There's all sorts of ways you can do it. The problem with the ways that don't involve cutting it out is you will leave a raw area, and if you're going to go full thickness, that area then has to heal from the sides by what we call secondary intention, so that scarring is not going to be quite so good. So all those ones that don't involve bringing the edges of the skin back together, which is the laser, the acid, dermabrading, scraping, all those ways of getting rid of that full thickness, you wouldn't really want to do that for a full thickness skin removal. So the best way to do full thickness skin removal is to just cut it out and stitch and bring those edges back together again and stitch it up. The problem with that is it leaves a scar because you're removing the full thickness of the skin, and then you bring the skin edges back. So that's excision and suture, and that's going to leave a scar. To be fair, all the other ways are going to leave a scar as well, and arguably the scar is going to be worse because it's going to heal by secondary intention. The fact of the matter is, often you get potentially some mole pigment cells are closer to the surface of the skin, so you can just remove the top layer of the skin, and that's why those other areas like CO2 is the other thing. CO2, laser, burning, and all those things might work for more superficial lesions because they're not removing the full thickness of the skin, and then the scarring will be significantly less. But there's always a risk that you haven't removed it all. So if you want a permanent solution, then excision and suture is the best way to do that. There are other ways to do it. As I say, you can do it with lasers and acids and what have you, but the scarring's potentially going to be worse because it has to heal from the sides in. So excision is the best way to permanently remove a mole to make sure that it won't grow back at all. Like anything, it needs a consultation. Really, you need to have a look at it to see whether it would be an option for a scrape or a superficial treatment. But you'd have to accept there's always a risk of it coming back with those superficial treatments, but the healing and the scarring might be less. Sorry. Yes, it's you. I think you mentioned it probably be dissolvable sutures before. Thanks, JJ. Yeah, you probably will on the torso. Probably will. Yeah. Okay. Well, if it's me, then yeah, 2 weeks is where I'm going on that one. How soon after having an epigastric hernia repair with mesh can I have a tummy tuck? Right, you've got an epigastric hernia repair with mesh. Now, the first thing that makes me think is I've got a bit of alarm bells here, to be honest with you. I'm thinking the cogs. Can you see the cogs going there? The first thing, if you know you're having an epigastric hernia repair and you know you want a tummy tuck, is do you want them both at the same time? Because that would probably be the most sensible thing, although I'm sensing there might be a situation like maybe you're having the epigastric hernia repair on the NHS and the tummy tuck privately, which you might think, you know, because the worry I've got with the epigastric hernia repair is if they make a scar that goes higher than the belly button, because that is going to impact your ability to have a tummy tuck. If they make a scar that goes above the belly button, we're in trouble. If the scar is limited to the around the belly button and down, we're okay. But if it's going above the belly button, we are in trouble, my friend. And you might be in a situation where you have your epigastric hernia repair and then you turn up for your tummy tuck consultation. They're like, hold on a minute, you can't have a tummy tuck because that scar's going to be a problem with the healing of the skin, which obviously would not be a great situation to be in, because it would be relatively a relative contraindication to the surgery having that scar, unless we could get above the scar and pull it all down. So that's a real concern for me. And I think if you haven't had either the procedure, you need to talk to the surgeons and potentially get the surgeons to talk to each other. You know, for the plastic surgeon, say to the epigastric hernia surgeon, what sort of scar are you thinking of leaving? Is there any possibility you can do it by having a scar that extends south of the belly button rather than north of the belly button, because I will be able to remove all the skin below the belly button, but I won't potentially be able to remove the skin going north of the belly button, so that scar might be an issue. So that's quite a big sort of alarm bell there. First of all, I think it needs to be thought about how the scar of the hernia repair is going to go. How soon? I mean, it's a relatively big procedure having a hernia repair, with particularly if it's with mesh. So 6 months, I would say. You kind of want to have it all healed. Yeah, 6 months. And again, I'm presuming you kind of spoken to your plastic surgeon particularly, because if it's a little epigastric hernia, we can often repair them when we do the tummy tuck. So you kind of need to speak to the people involved really about that one. But I would say 6 months, assume it's all healed, because you want it all to soften up, because you have to put it together, and we often repair, bring the muscles closer together, and in doing that, small hernia repairs can be fixed at the time of a tummy tuck. But if it's with mesh, maybe it's not a small one, actually, maybe it's quite a big one. Yeah, 6 months would be a kind of ballpark figure, but if you don't heal up so well, it might be longer. If you heal up really well, it might be less, but you want everything to soften and all the scar tissue to soften. Probably ideally 6 to 12 months, I would say, would be kind of like where I would be going between those two surgeries. But yeah, needs a bit of thought, that one. How to prevent a stretch scar after tattoo excision on your wrist? Yeah, I mean, I guess surgeon factors and patient factors on that one. So surgeon factors, from our point of view, it's thinking about orientation of scar. So we would probably want, if we've got a choice. So often with tattoo excision, you haven't got a choice for orientation of scar, because if it's kind of long and thin, you're going to want to put the scar in line with the tattoo, if that makes sense. If the tattoo's a circle, then you can orientate the scar any way you want. But if the tattoo's in a kind of oblong shape, that's going to dictate the orientation of the scar. I don't know if that makes sense, but so yeah, if you have got an option for orientation of the scar, you'd probably want to orientate it longitudinally, so it's not under tension when you move your wrist, because when you move if you put it transversely, if you move your wrist, you're going to put some tension on it, which might make it more likely to stretch. Also, transverse incision on the wrist might look like a self-harm scar, so there's some sort of psychological sequelae, is that the word, or connotations, or anyway, potential effects of a transverse scar on the wrist. So we probably want to, if we can, orientate it longitudinally, and again, if we can get orientation to more the neutral parts of the wrist rather than the here, there's more tension here than if you can put it on the sides. I don't know if that makes sense. So again, if we can do that, that would be good. When we do the surgery, we would probably want to perhaps put some, or certainly want to put some deep closure in with some deep sutures to take the tension off. The problem with the deep sutures is they can make the scar quite red when they dissolve, and sometimes they spit out and cause problems. But that will help to take the tension off and help with the risk of stretching. In terms of patient factors, then really it's taking it easy. Sometimes when you do really big excisions, you might actually put someone in a splint so they don't move their wrist so it heals properly. Now the risk of that is you can potentially get stiff wrist is the risk of that. So that's a little bit extreme, putting you in a splint, but maybe a bulky dressing, or just saying to you, just try and take it easy, not to try and put too much tension on your wrist, certainly in the first few weeks while it's healing, because putting tension, carrying bags or lifting anything heavy is going to put tension on that wound and increase your risk of stretching it. So being very careful in the first few weeks while it's healing, and then giving it a good massage to try and soften up the scar once it's healed. Usually wait several weeks before doing that to try and soften up the scar and give you the best chance of getting the best scar possible. So yeah, those are the sort of things I would think about if you want to minimize your risk of your scar stretching. How long does it take for tightness to ease after tattoo excision? So a week. Excusez-moi. yeah, I think it will feel. I mean, it depends on how much you removed. If it's not removed much and it's not much, then it will get after a couple of days. But yeah, I would say a week it'll probably start to feel better, and after a couple of weeks it'll, yeah, week or so, I would say. How to make your scar fade quicker after tattoo excision? Oh, these are heavy. We're heavy on the tattoo excisions today. The best things are look after yourself, don't smoke, avoid sun exposure, drink plenty of water. That's the best. That's good for your skin, good for your healing. Specifically in terms of the scar fading, again, don't get a tan on it. If you get a tan on it, it will stay tanned. So avoid sun exposure, moisturize and massage, avoid tension so that it heals up nicely. Moisturize and massage are the main things for me. There are other things you can do for scars that are problematic in terms of steroid injections, silicone dressings, but they're normally for problem scars. So most normal scars, moisturize and massage is the mainstay of what we would do for it. I have a flat mole on my nose and it never went away. I've tried to remove it with laser and the doctor scraped it once and it came back again twice. How do I remove it permanently? Well, this goes back to the question at the top of the hour where we spoke about permanent removal. I mean, this is the thing. So the doctors tried laser and scraping it. So those have probably just superficially removed the skin, and they're good if it's a superficial lesion, if it's a superficial mole. But if the mole, if the pigment cells are going deeper, then that's why what will happen if you do laser or scraping, you'll get a wound. The wound then heals, and then once it's healed, the mole's still there because it's going deeper. So you've got to look at potentially having a full thickness removal, and it's difficult on the nose because the nose's skin's quite tight. So it is difficult on the nose, but I think excision would probably what I'd be thinking of, because as I said earlier, that's probably the best way to make sure you're permanently removing a mole. It also avoids, it also allows you to send the mole off for histology, which is another benefit, which you don't get with things like scraping and laser. So so excision would probably be my advice on that one, but need to take advice because, as I say, the nose is quite tight, and even a small mole can be a bit of a challenge to remove on the nose, and you have to be accept a scar, because an excision would leave a scar, although we aim to make it as neat and as small as possible. So I missed anything. So it's just people joining. Yes, it is you. So yeah, so that's me done for the 2024 January the 9th session. God willing, I'll be back next week. If you've got any questions, please email me, please Instagram me or Facebook me or whatever you want, and I will do my level best to answer them. And I very much look forward to seeing you here, same time, same place, next Tuesday. Hasta la vista, baby. I'm sure Facebook's not working. I'm sure there'll be more.